Today I want to start with an uncomfortable truth. There's rampant poverty in the United States. The reality of our country is that we exist in a time when 45 million people in the United States live below the poverty level. I know there are lots of smart people in this room, and I'd be willing to bet that many of you have thought about poverty before. It seems that in the United States, the land of opportunity, with fancy cars, huge banks, sports stadiums, we'd be able to fix it. And yet we haven't. I have the privilege for working for a nonprofit organization called Uplift Solutions. At Uplift, our mission is to deliver entrepreneurial solutions that support underserved communities for the joy of a healthy life. To put it simply, we work to open grocery stores in food deserts. Now, if you're like I was before I came to Uplift, you're going to ask, what's a food desert? And a food desert, this is the United States Department of Agriculture's definition, is a low-income census tract where a substantial number or share of residents has low access to a supermarket or large grocery store, where at least 33% of the tract's population, or a minimum of 500 people in the tract, must have low access to a supermarket or large grocery store. In layman's terms, urban areas, if you live within 1 square mile without access to fresh food, you're in a food desert. In rural areas, it's 10 square miles without access to fresh food. There are 23.5 million people living in food deserts in the United States. Once you're in the business of eradicating food deserts, you quickly learn that that's a misnomer. Food deserts are really resource deserts. Along with food deserts, almost always come healthcare deserts, education deserts, financial deserts. These are areas with vibrant, diverse populations that have been told both directly and indirectly that they're not worth investing in, that they are not worth investing in. So how and why does Uplift plug into these communities that so many have already forgotten? Uplift Solutions was founded in 2009 by Jeff Brown, a fourth-generation grocer, and also a former Penn Charter parent. Jeff was already doing work in Philadelphia, opening stores in underserved areas that other grocers actively avoided. The conventional wisdom was that opening grocery stores in food deserts was a suicide mission and that they would never be profitable. Opening grocery stores in food deserts is certainly a unique and challenging venture, but delivering entrepreneurial solutions to these areas can make them sustainable business ventures. Jeff was arguably the first person in Pennsylvania, if not the country, to successfully do this work. And that got the attention of the Pennsylvania legislature. That then led to the creation of the Fresh Food Financing Initiative here. The FFFI is the name for the fund specifically created to support grocery development in underserved communities. The success of the FFFI gained national attention, and President Obama and the First Lady invited Jeff and others to create this program nationally. The federal treasury and other private funders leveraged $120 million in funds specifically to support supermarket operations in food deserts. This fund is called the Healthy Food Financing Initiative, or HFFI, and the First Lady's Let's Move initiative and other programs fall under the HFFI as well. Perhaps what I find most inspiring and the largest takeaway for me when I think about financing of this financing initiative is that oftentimes for-profit businesses, like grocery stores, operate in opposition to the communities they exist in. They don't have to bother to serve the community because they know that people will still come buy their products. I believe that our model is light years ahead of its time in terms of corporate social responsibility. Think about what the world would look like if every business in existence truly took care of the neighborhood from which it draws its clientele. This work launched Uplift Solutions, and we remain dedicated to the mission of providing food access, health access, and access to capital in underserved communities across the country. One would think that once a large fund has been developed for this type of operation that it would be easy, but it's not. In the wake of this realization, Uplift Solutions transformed into more of a nonprofit consultancy. We have had the honor of working in 39 states up to this point, and I'm looking forward to the day where we can say we've worked in all 50. Our work is divided into 3 verticals, or 3 lines of business. First is sustainable food systems. We work with operators, developers, and local governments, and more, to bring fresh and healthy food access to underserved neighborhoods across the country. We always begin this process with a feasibility study. We do the legwork of finding out what the median income of an area is, what competition exists there, what community organizations exist there, population density, etc. Based on that study, we lead off with market suggestions in terms of what type of operation the community can support. We make recommendations on anything and everything from site selection, staffing, product development, and type of operation. Not all food deserts can support a full-service supermarket. We also work with farmers markets, cooperatives, and convenience stores. Our aim is to choose whichever option best suits the community. We also do turnaround work. Food operations that are in danger of failing can come to us and we'll make suggestions about how they can once again be profitable. We recently went as far as to lend one of our managers from a project to a struggling supermarket to retrain their staff. The last piece under sustainable food systems is that we design systems to move food from surplus to need. So, there's still a remarkable amount of food waste in this country. People have mostly figured out how to deal with non-perishable items, but dealing with perishable items is a different story. Recently, we worked with Drexel's culinary program to design recipes specifically for food about to go bad and delivered those recipes to community organizations and individuals. Our second line of business is health innovations. Areas that are food deserts almost always have populations with high incidences of chronic disease. Obesity, diabetes, sickle cell anemia. These areas typically don't have access to health care. The issue is that it's either too expensive or it's too far away. We at Uplift believe that grocery stores should be true community hubs. In keeping with that line of thinking, we created Q-Care clinics. We put healthcare clinics inside of our supermarkets, leveraging the supermarket as a point of access. These clinics typically find themselves somewhere between a primary care and an urgent care type facility, and we match each location with a local provider to operate the clinic. At most of our clinics, you can be seen for $30 for a well visit and $20 for a sick visit, regardless of whether you have insurance. We also use that connection to a larger network of healthcare providers to introduce our patrons to primary care physicians and specialists that they can see outside of the clinic itself. In 2015, we also introduced a brand called Q-Life. Within our supermarkets, we provide wraparound healthcare services. These are services that aren't typical medical services. So benefits access, dietitians, tax preparation services, community health resource navigators. Imagine if you're being seen at a clinic for diabetes. The nurse practitioner may provide you with a prescription, but they will most likely also suggest changes to your diet. In our stores, the nurse practitioner can introduce you to our dietitian right on the spot. The dietitian will take you on a tour around the store, showing you healthy food to eat and helping you read labels. Then you might realize that if you want to eat this food that's been recommended to manage your diabetes, that it's a little more expensive than what you were going to buy if you had not met with our dietitian. And then our dietitian will walk you over and introduce you to our benefits access coordinator, who may sign you up for SNAP or other entitlement services. This is what we mean by entrepreneurial solutions for the joy of a healthy life. The last line of business is our Community Development and Financial Institution, or CDFI. We have our own pool of money that we lend to operators and developers in areas we work. Another way that underserved communities often get the short end of the stick is that they not only have a general absence of traditional financial institutions in their geographical locations, but traditional lenders consider it a bad investment to lend to them. We're able to lend our own money to help projects get off the ground that may otherwise never have a chance. Opening supermarkets also creates large amounts of jobs in communities that often have high rates of unemployment. And we allow organizations that lend to us to make their principal and their interest back, which makes lending to us attractive while we manage these investments. Once they lend to us, we're able to lend to people who may not otherwise have access to those funds. Now I'm going to take a step back. I recently started listening to a podcast where every time a guest comes on the show, they ask, what do you do and why? So you heard the what, and here's why. I'm angry. I'm angry about the way people in this world are treated. I'm angry that persistent poverty exists, and that we live in a world where exist the resources to fix these problems, and they don't change. I grew up extremely privileged, probably like some of you. I grew up in a world where private planes were normal, and I got a credit card before I could drive. Now, I've always felt relatively conflicted about this. I think it's human and authentic to enjoy nice things. I loved being able to go wherever I wanted to on vacation whenever. I liked spending money on clothes. But let's be real, that's ridiculous when there are people starving in the world. I also felt ashamed sometimes about what I had, and then guilty for enjoying what I had. It's complicated inside my head. I also felt like my family had worked extremely hard, and I should be able to be proud of what we had. Clearly, I've thought about this a lot, and as I've grown up, my career path has transformed into working in nonprofits. I've thought about it even more. The why of my work isn't because I'm trying to assuage some guilt or because I think I can fix everything with my resources. But to some extent, the why is because I am so thankful for what I had and what I have, and thankful for people who challenged my existence and provided experiences in which I learned that my existence is the exception and not the rule. So where does this privileged woman working in nonprofits who's angry about all of the injustice in the world focus her energy? I focus it on living in the discomfort. I started off by telling you that poverty is an uncomfortable truth. The fact that there is rampant poverty, abuse, injustice, and exploitation in this world, in food deserts and otherwise, is uncomfortable. The fact that I grew up in a family with multiple homes while others live on the street is uncomfortable. The fact that I have a lot of inherent systemic advantages while other people have inherent systemic disadvantages is uncomfortable. Almost all of my meaningful decisions in reference to my career, to my faith, to school, to my significant other, and to my family have come out of periods of discomfort. To some extent, learning how to live in the discomfort of the unfairness of this world and the juxtaposition of experiences breeds the most beautiful and authentic paths and ideas. I will never feel 100% comfortable with the fact that I have had so much while others have so little, or that I live 5 blocks from a supermarket and other people live 20 miles from one. But I don't want to be comfortable with that. As you're sitting in front of me, people who are making big decisions in your lives, I encourage you to be okay with living in the discomfort, to learn to dream big and confront issues whether it is easy or not, to dream the biggest dream you can and be okay with it when trying to make it come true makes you so scared that you want to stay in bed all day. Some of the most innovative and impactful solutions for problems, such as eradicating food deserts, have come from looking at problems that make us deeply uncomfortable and dreaming up solutions so big they make us want to run away scared. In my own life, I'm fine with living in the discomfort, as I call it, because like the people in the communities we aim to bring access to food and access to health and access to capital, I have God-given dignity and I can choose the way I view the world and why. We all are allowed the space to think about who we are and how we can plug into this world in a life-changing way, and I encourage you to use that space. I'm using that space to work on health equity for all people, and I know that there are people in this room using that space to dream as well, and I'm excited to see what happens when those dreams come true.